Study section 16. Psychological disorders, affective disorders. Introduction. An affective disorder is usually characterized by two primary forms of mood disorders, depression and mania. When depression occurs alone, it is a condition known as major depression. However, mania seems to always alternate with a period of depression. Bipolar affective disorder. However, both conditions produce great misery for the individual. Objectives. At the end of this lecture, you should be able to 1. Distinguish between major depression and bipolar affective disorders, and 2. Explain the factors that predispose an individual to depression. Contents. Major depression. Major depression is a condition where an individual is deeply unhappy with little pleasure in life. To the individual, the future is bleak, and persons hold a negative opinion of the self and others, and often sees no reason to live. This condition is accompanied by the following: decrease or increase in sleep, increase or decrease in appetite, loss of interest in sex, loss of energy or excessive energy, difficulty in concentrating, feeling impelled to commit suicide. Major depressions are episodic disorders. They occur for only a period of time, after which the individual recovers and returns to normal state. In many cases, persons with major depressions recover within 12 to 20 weeks from the beginning of the depressive episode. Easton et al. 1997, Solomon et al. 1997, 2000. In some cases, it reoccurs at periodic times, which may last for several weeks to many months. These periods are followed by periods of normal moods. The probability that an individual will develop major depression for the first time is very low until puberty. This probability rises until it reaches a peak between 45 and 55 years of age, and then declines in old age. Averagely, the risk for major depression is twice as high for women than men, particularly during middle age. Easton et al. 1997. Major depression is often relatively mild. People with mild depression are very uncomfortable, but they can cope with demands of everyday living. Severe major depression is less common, but is more disabling. This is often accompanied with distorted or bizarre psychotic distortion of reality. The risk for major depression is significantly more in persons experiencing high level of stress. There is evidence that some people are more vulnerable than others to depression due to genetic reasons. Kendler and Prescott, 1999. Cognitive factors in depression. People sometimes develop depression when they hold negative views of themselves and the world in which they live and the future. Studies by Alloy, Abrahamson, and Francis, 1999, showed that people who believe that they fall short of being the people they would like to be are more likely to experience depression. The reason that depressed persons often fall short of their ideal is that their beliefs are perfectionist, and Witt and Flett, 1993, found that people who believe that they should be perfect in their work are likely to develop depression if they fail even slightly in their work. It could also be that people who hold perfectionist view in their social relationships would become depressed if their personal relationships are not going well. Contrarily, people who do not expect perfection of themselves do not become depressed when things do not go well. It is not bad things happening to us that are upsetting. It is our interpretation of such situation that makes all the difference. Having a positive opinion of yourself makes depression less likely following stressful life events. When people become depressed, their cognitive changes. They become more pessimistic, more critical of themselves, more likely to blame themselves for everything bad that happens. When the period of depression goes, they return to a more positive state. Bipolar affective disorder. In bipolar affective disorder, periods of mania alternate irregularly with periods of severe depression. Mania is a period when the individual experiences a remarkably high mood. The sensory pleasures are heightened. The self-esteem is very high. Little sleep, unrealistic optimism prevails. Grandiose and financially damaging schemes and buying sprees are common at this period. Quitting jobs, getting a divorce, engaging in sexual promiscuity, and a psychotic distortion of reality are also common at this period. This disturbing mood can be quite enjoyable to the individual in the short run, but it is usually very damaging to both the person and to others in the long run. Mania may occur only once, but it returns in multiple times. When it reoccurs, it alternates irregularly with episodes of severe depression. This alternating disorder is known as bipolar affective disorder. Bipolar affective disorder is an uncommon disorder. It is equally common among women and men. It can be treated effectively with medications. Summary. 1. Major depression is a condition where an individual is deeply unhappy with little pressure in life. 2. Major depressions are episodic disorders which occurs for only a period of time and then the individual recovers. 3. The risk for major depression is significantly more in persons experiencing high levels of stress. 4. The reason that depressed persons often fall short of their ideal is that their beliefs are perfectionist. 5. It is not bad things happening to us that are upsetting. It is our interpretation of such situation that makes all the difference. 6. In bipolar affective disorder, periods of mania alternate irregularly with periods of severe depression. End of study section 16. Thanks for listening.